So when it comes to testicle implants, how big can you go? In this video, we're going to talk about the typical sizes patients choose when doing testicle augmentation and what is the largest we've put in and some considerations about this. So first of all, as you can see, these blue sizers, these are what we call the off-the-shelf implants. They are smooth round silicone implants. They're extra soft durometer, and they are what I prefer to use in my practice because patients tend to tolerate them really well. As you can see, they're really soft. They can't rupture and leak like breast implants. They're actually what we call carving blocks. So if you cut them, nothing leaks out. So typically in my practice, patients will choose, depending on the reason they're getting the implants, if they're replacing a testicle, typically we'll use one of these to match the other side, or if they're doing testicle augmentation for the off-the-shelf option, usually we'll start with this one. This is 5 by 4 centimeters and the biggest that's available off the shelf. There is one size smaller than this, but we rarely use it. As you can see, the ratios are about the width of the implant is about 0.8 of the height. So this, for example, is 4 centimeters wide and 5 centimeters tall. When we get into the custom implants, patients can design these completely, and we like to work carefully with our patients because it's their body, obviously, so they get to decide. So here you'll see slightly different height to waist, or to height to width ratios. And for example, this is a 7 by 5 centimeter implant, about the biggest we put in. Not many scrotums can tolerate this implant, so we have to choose this implant carefully with our patient. Then this would be a more common size. This is 6 by 5 centimeters, and this is probably the most common custom implant we use. This is 5.5 centimeters by 4.5. But again, because they're custom implants, the patient can choose exactly how tall they are relevant to the width. Not all patients can tolerate these larger implants. There is a lot of variability in what a scrotum can accommodate. I subscribe to the fact that I think external stretching does help somewhat in order to accommodate the bigger testicles. But typically, if a patient chooses to make a large testicle like this, we'll have a smaller testicle as backup, and with the patient's permission, if they don't accommodate this one, we can put this guy in. However, touch wood, that very rarely happens. But again, not every scrotum can accommodate these testicles. And as we put in bigger implants, theoretically, your risks of extrusion, meaning the implant coming out after we put it in, and you therefore losing it, or infection, increase. So I hope this helps. This is the range of implants available. And like I said, for most patients, for testicle augmentation, we're going to want to start here at around 5 by 4 centimeter, depending on the patient's original testicles, because of course with the side-by-side technique, we're going to obscure the patient's native testicles. So we want something big enough so in the natural position, we're not going to have a 4-pack that the implant itself is going to disguise the native testicles very well.